We Today we'll be talking about something very interesting. But before we start our topic, I would start my presentation with my favorite question, with a portrait or a painting in the background, as you can see. So the question is, what are we missing? And I shall explain the painting to all of you who are able to view the painting. There's an elephant, as you can clearly see, in a small room, and you can see there are people. People are absolutely engrossed in their day-to-day whatever work that they are, absolutely oblivious to the fact that there is a huge elephant in the room. So, in the same way, what is this huge elephant in our life? What is it that we are missing out on? And I would actually be happy if you all could try and answer that question in the chat box. Try something, people. What do you think is in your life an elephant, which you all have actually missed out on, not thought of, not focusing on, not taking care of it off? I'll give you all 30 seconds. Then let's start our topic. Balanced work life, yes. Very good. HR, notice this is a very good answer, and hopefully y'all can help your employees with a balanced work life. Yes. What else? Come on, people. Healthcare, excellent. Yes. Healthy eating and some physical exercise, part of your balanced work life. Yes, Mohit. Okay. So I think, yes, balanced work life is a very apt answer. To add on to it would also be something that is absolutely like a huge elephant in our life, and I'm talking about our mental health. Mental health is one thing that nobody cares for. We take somewhat care of our physical health when some of your friends, some of your family members start telling, oh my God, you're gaining weight. Look at your tummy, it's coming out. Look at your cheeks. Look at the way you're getting tired while you're walking. Check your blood pressure. You need to control your sugar intake. Physical health is somewhat taken care of, but mental health, not at all. Mental health is what? It is the care of your mind. Just like physical health is care of your body, you exercise, you eat well, you take a spa. What about your mental health? How many of you can say that you all have done something for your mental health? But yes, I would say that post COVID, people have changed. People have started doing yoga, meditation, attending talks where you understand about mental health and stuff. Yes. So that is what the significance of mental health. And if you take care of your mental health, automatically your performance at your work, at your day-to-day relationships, daily lifestyle, so the question that we need to ask ourselves, what is it? What is it that you think is the most important question for today's presentation? How healthy are you? And how do we answer this? By looking in the mirror and seeing how many abs you have, or maybe just, maybe taking some sunscreen and applying it on your face? Obviously, no. You understand how healthy you are with the help of certain investigations, that is tests. Number one, that is something internal. But externally, how do we come to know? By your fitness levels. How long can you, stand? Probably how long can you jog? How much can you, do your work on a daily basis without getting tired, without getting, fried in a manner where you kind of start making mistakes? This is how you determine how healthy you are, not by, your physical appearance. And if someone is thin, does not mean that that person is healthy. or someone is extremely obese does not mean that they are absolutely unhealthy. Yes, they are unhealthy, but they must be taking care of themselves. On men's health and particular focus on men, because as we all know, unfortunately, somewhere or the other, men disregard themselves. They think that they are supermen, literally. They just keep on working, they take care of the family responsibilities. Obviously, times have changed, and now equally both men, women are taking care of the responsibilities. But somewhere down the line, it's obvious that women going through periods, women going through pregnancy, and such things make a huge difference. So that is the reason why men are unfortunately disregarded. So let's figure out some facts about men's health. On an average, it's been seen that men live about 5 years less than women. That's surprising and quite shocking, isn't it, for all of you? 1 in 2 men develop cancer. Isn't the usual focus on women cancer, breast cancer, or ovary cancer, or other related cancers? It's been seen that men have a higher death rate for most of the leading causes of death, which include cancer, heart disease, diabetes, suicide. And approximately 30,000 men die each year from prostate cancer. Prostate cancer, I'll be talking about in the further slides. It's been seen that men make half as many physician visits for prevention as compared to women. And that's where this talk comes into use. Today, after listening to this, I hope at least more than 50 to 80% of you go and get yourself checked. And naturally, it has been found that men are more likely to be uninsured as compared to women. See, it's not that we are fighting kind of or debating on the question on men or women. It's the point being is that we need to take care of men equally as much as women. And right now it's not equal, it's less. So I'm not saying that women don't take care of yourself. Women, obviously, you need to take care of yourself. You all are the backbone of the family, of the society. But beyond that, men also need to start taking care of themselves. So why don't men take better care of themselves? We did ask this question. We did answer that also partially. On that's because they're stuck in their own responsibilities. But what are the other things that we need to understand, which is why men do not? And for those women who are listening to this, y'all can probably take care of the significant men in your life. Maybe it's your friend, maybe it's your brother, it's your husband, it's your father, it's anyone who you care for. And for those men who are attending, maybe for your friends, you all can go and recommend this as well. Since childhood, parents for boys are always very strict in a manner. Yes, they pamper them too. It's like obviously ghar ke chirag and stuff, but at the same time, they are raised in a manner telling them that you are, very strong. You are a man. You're not supposed to cry. Isn't this the question that we really ask? Mard ko dard nahi hota. Why? If they cry, do they look weak? Or if they take the side of any significant woman, then are they not man enough? Or you can't, be emotional and take care of yourself in a good manner? Then do you become someone of the opposite gender? Obviously, no. So unfortunately, when men are asked to ignore all the pains in their life and not worry about things till it reaches to the most drastic step, eventually they are taught to not go and visit a doctor. So this needs to change. This is based on the stigma. And surprisingly, this is only in our country. In outside our country, it's been found that the ratio is much more equal as compared to in India. So why? Why not? And I mean, as you must have seen recently, this movie called as Jayesh Jordar. In that also, this is the exact same topic that was spoken of. But unfortunately, that movie did not work out well in the audience. Also, one more reason is a fear of annual health examination. What is an annual health examination? Is this like an exam or something? No, it's just a blood test and some scans done. What men fear is, oh my God, if something comes up, then what will we do? How will we take care of the additional responsibility beyond whatever we are earning? How will we take care of the additional things that we need to do for the family? Our priorities are our wives or our mothers or our children, but no, not us. If we have some problem, maybe we'll delay it, maybe we'll go later on. So we are scared. If something comes up positive, then what to do? Rather, let's ignore it till the point either something drastic happens or it's now or never. In that classic age group wise description, I would say that in our 20s, men say that they are indestructible. They are very young, they're very active, very virile. They have testosterone, so they can run around, do whatever they want, and nothing will happen to them. Unfortunately, even when we speak about sex education or things, it's usually given to women more than boys, or men for that matter. It's always that women are spoken of that you were not supposed to wear this short dress or something of that sort. But men, no, we don't need to teach them anything. They know everything. That's unfortunately very wrong. In their 30s, they become very busy. Yes, they're managing their entire family. They're, as I said, significant better, the children, whatever it is. And then comes the 40s or the 50s where they think now it's too late. It's okay now. It's almost the end now. No, it's not the end. You can live healthy. You can do better. And if you are better, you automatically reflect that in your family as well, naturally. Let's look at a very gruesome topic of what are the leading causes of death in men. Heart disease comprises almost of 26%, while cancer almost reaching equally is 24%. Any unintentional injuries or any respiratory infections, stroke, diabetes, they comprise approximately of the range of 6 to 3%. And then comes something significant which we never expect in men, but it is equally there, that is suicide. Yes, men also attempt as well as end up, unfortunately, in suicide. Influenza and pneumonia, kidney diseases, and yes, Alzheimer's disease. These all comprise quite commonly the causes of death in men. So ask yourself, everyone, when was your last checkup done? Let me see what is the responses by the group. Come on, answer in the chat box, everyone. Two years back, this year's beginning, 10 days back, 4 months, 2 years, 4 to 5 years, a week back. Very good. 5 months, last month, last month. Oh, very interesting answer. Don't remember. Exactly my point. So yes, this is what I'm talking about, that probably we are missing out on something called as an annual health checkup. But annual health checkup does not mean that you are compulsorily allowed to check your health only once or only if your company is sponsoring it. So you're waiting for that annual health checkup, that when company will do it, let's go and get that test done. You need to do it whenever you feel, like I said, certain things that are different in you. For example, when you get tired easily while walking, or you're not able to climb steps that easily, you don't find it very easy to hold your child. You while you're working, you feel very exhausted and your eyes start paining, you start getting frequent headaches, you tear up without any reason. So many things that can point towards you going and getting yourself tested. And what's the harm? If something comes up positive, there is a treatment for literally every ailment in this world. Is complete physical with chest x-ray and blood work a complete checkup? Obviously, no. This is only part of it. And this is what I was talking about. That this is only something that gives you half of the information. But then, how often do you change oil in your car? Is it like once a year only? No. So that means your body also is going through a lot of wear and tear. And which is why just a normal blood test and a x-ray and stuff is not enough. You need to go beyond it. You need to probably get yourself checked even emotionally. maybe go and get yourself tested for other things as well. So it's always necessary to be prepared. Nowadays, fortunately, preventive medicine is taking a better control over the situation than treatments of the problems. And preventive medicine is actually much more useful, and it prolongs life rather compared to something that we do immediately. What are the most common excuses that I have heard whenever someone, avoids going to doctor? Nobody has. I don't like doctors. Who likes them? I'm afraid of finding out that something is wrong with me. I don't need to go until I'm older. Only old people visit doctors. I guess most of you must be recognizing some of these. Yes. If you all are saying that these are these excuses, please give up on these excuses and go and get yourself tested. So, how do we find a doctor? What are the challenges that you face when you're finding a doctor? Yes, quite commonly, it's the insurance factor. We don't have, see, I agree that annual health checkup, the ones that you get tested with the help of the company, goes about maybe 10, 15, or maybe even 20 grand. And that's a huge chunk of your savings that you need to put in. So probably you don't need to do all of these. Maybe you can just visit your physician. MD physicians I'm talking of, they can suggest you specific tests, maybe like a specific, not an entire kidney test, but maybe just a creatinine for kidney. And there you can understand whether there is a problem or not. That's like a screening. And if that comes out to be normal, then you don't need to do the entire test. And yes, fun fact, most men spend more time and resources purchasing electronics than choosing a doctor. Ask your friends or co-workers, they will tell you who are good, who they felt comfortable with. Maybe you can try it out. Start with first a general practitioner. Your family doctor is always the best doctor to go to because they will guide you the best, they take care of you, and they know that they can't go anywhere. And if they make a mistake, you come back to them only. And yes, sometimes when something comes up, they need to refer someone. Like for example, there are these family doctors in our neighborhood who see these patients, and when the patient starts crying in front of them, or they say that they want to attempt some suicide or something, immediately the doctor calls me up and tells me that I have a case which is of your specialty. He is complaining of some anxiety, and I think you can take better care of them. Yes. And most importantly, it is someone that you feel comfortable with. So even though I'm a psychiatrist, but I do practice general medicine as well. And there are so many of my patients who come to me just for even fever or other general checkups. Obviously, it's not necessary that I'll treat them for all these conditions. Whenever I feel that, yes, you need a more apt control of your blood pressure or diabetes, then I send them over to someone else as well. So let's understand the risk factors, and we can divide them very easily into what we can control and what we cannot. So let's go first into what we cannot control, which includes obviously your age. It keeps on going despite the fact that all of us want to be young. Yes, gender, again undecided. And then if something comes up, hereditary wise. But what do you control? Yes, whether you smoke or drink, whether your diet is healthy or not, or you're eating all those fun stuffs, which is some vada pav, chow mein or something of that sort. How much you exercise, I know it's very boring to exercise, but that's something in our control. And last and most importantly, stress management. Stress management, yes, we all say that yes, it's under our control, but really, how many of you feel it is under our control? Let's understand some numbers over here, which when you see your blood reports, you will understand whether it's positive or not. For example, in cholesterol reports, we see that there is an LDL and there is an HDL. Sometimes we see that the HDL is raised and we think, oh my God, is that a problem? So for you to understand, HDL is the healthy one and LDL is the lousy one in a way, but it's not the full form of L or H. So this is low density lipids and high density lipids. The high density ones are actually protective, they keep us healthy, while the low density ones are responsible for all those problems related to our heart and brain, that is strokes or heart attacks. And eventually total cholesterol should be below 200. The bad cholesterol should be below 100. The good one should be above 40. Triglycerides are the raw form of lipids which should be below 150. Blood pressure is ideal 120/80, but plus or minus 10 to 20 is usually allowed for the systolic one, which is the first part, that is the 121, while plus or minus 10 is allowed for the diastolic one, that is the 81. And most importantly, glucose, which is responsible for causing diabetes, should be below 100. So, which are the types of screenings that you need to do and when do you need to do them? For your weight wise, that is something that you should measure through your BMI, not by the way you look or the way your clothes or something is fitting or your friends are commenting on you. So to check your obesity, you need to do an BMI annually. You need to check your cholesterol every year, at least after the age of 35. Blood pressure, ideally speaking, at least every 2 years, but nowadays it's become very simple. You just need to get to the Omron by this thing blood pressure machine, and it's very simple to check your blood pressure at home itself. Colorectal cancer, which is a very common cancer in men, is something that you should check every year after the age of 50. Diabetes beyond 40, you need to get your blood sugar tested. Depression, yes, my specialty, something that you should experience and feel in case you're feeling that, and go and talk to someone, even if you're not sure whether this is depression or not. Just go and meet someone. Maybe a psychologist is also good, who will just guide you whether you need just therapy or medications. If you meet a psychiatrist, they will guide you whether you need therapy or medication. But basically any mental health specialist, it's an umbrella basically. And lastly, any sexually transmitted infections or HIV whenever you are too sexually active or you've had unprotected sex, which is nothing to be ashamed about, but then you need to take adequate precautions. And if you start getting any lesions or anything in your genital area, then you need to definitely go and meet a doctor. So, yes, how do we manage our stress? This is a very interesting question that everyone asks me, doctor, too much of stress, how do we handle it? Obviously, the first response to that, which I say, is avoid stressful situations. If you know that working at your workplace for 10 hours instead of 8 hours is making you stressful because you reach home late, your children are sleeping, your wife is upset with you, your parents are angry with you for not going anywhere outside, your friends do not meet you at weekends as well because of that. Yes, these can be stressful situations, and identify these stressful situations. Very simple to identify them. All you need to do is point out a trigger, whichever this thing disturbs you. Start practicing deep breathing exercises. Deep breathing exercises is not just sitting and taking deep breaths. There are various ways of doing deep breathing exercises. One of them, the most common one, is called as 4-7-8. Remember these numbers. 4 seconds to breathe in slowly, 7 seconds to hold your breath comfortably, and 8 seconds slowly to breathe out. You need to do this cycle 4 times together. That is 4-7-8, 4-7-8, 4-7-8, and 4-7-8. After this the cycle of 4, you do it again after some time, totally in the day, almost 5 times, because it's so simple. You can be sitting in your office chair, closing your eyes and doing it. Practice this deep breathing not just because you're being told to, but because it actually filters all the negative thoughts out and gives you some calmness. Whenever you breathe, it's like servicing your body. Then comes exercising. Exercise at least 20 minutes a day. It's fun to exercise. Come on, you can go for a jog. Maybe you can do some indoor exercise. Who doesn't want six packs? But don't aim for six pack always. Do it just because you need to have a healthy body, and your heart and obviously your brain also becomes healthy with the good blood flow that is there in your body. Change your thinking. As simple as it sounds, it's obviously not that simple. Changing your thinking requires to identify first the negative thinking. This is particularly a therapy. So once you identify the negative thinking, then you go over to the positive thinking on what needs to change in this negative thinking. If you're not able to do it by yourself, you can always visit a psychologist or a therapist who will definitely help you with it. Then comes another important question. Do not fret about things that you cannot do anything about. Like, for example, in the COVID period, a lot of people were stressing out about, what will the world go through? What are the people going through? Before all those things, start taking care of yourself and the things that you need to do. Maybe use the sanitizer, wear your mask, avoid going out. Those were the things that were in your control. What was not in your control was controlling your neighbor or the world. They will take care of themselves by themselves. All you need to do is stay safe, because if you're safe, your family is safe, it's all safe. So remember, whenever you think that you're fretting too much about something, divide that topic into what you can control and what you cannot, and you have the answer in front of you. You cannot change the stressor, but you can change the way you react to it. And this is exactly what stress management is. So start understanding what is the difference between stress and stressor. How do we prevent lung cancer? Is it preventable? Yes, quite often it is. Parts of it can be if you avoid smoking. And when I say avoid, does not mean come back, cut down to one smoke a day. No, zero. No smoke a day at all is the safest option. And it's not just this. Along with that, you need to start having a diet which is rich in fruits, vegetables. Antioxidants in these fruits are healthy. They kill all the cancerous cells if there are any in the body. It has been found that your diet plays a very important role in preventing cancer. There is a very interesting test called as a radon test, which detects any invisible gas which could be harmful. All of you will have heard the Chernobyl tragedy, or you'll have heard the Bhopal gas tragedy. So these were harmful gases which were directly harmful and visibly harmful, and they created all the damage instantly. But there are certain invisible gases also which could be present in our maybe house or nearby environment, because there could be some factories. Nowadays, obviously due to the industrialization, things have become too difficult for humans to live through. Yes, you're exposed to maybe some fumes at your work or maybe in your home, you don't realize it. Maybe these air fresheners that you think that are very safe, but they're obviously harmful. So get these things very carefully checked, because all of this is something that we're breathing, and as it goes inside, it becomes heavy for the lungs and obviously harmful and damaging as well. You might say that yes, I don't smoke, but passive smoking is obviously happening when you are in your workplace, in your obviously break area where people are smoking and talking with you. They obviously blow that entire smoke to you and it's going into you. This is called as second hand smoke. There's a concept called as third hand smoke as well. Isn't that very interesting? What can third hand smoke be? It's when you're smoking, that fumes go and attach at the walls, at the doors, at the surfaces, maybe the table, maybe the appliances, the instruments that you're using. And when the other person comes around it, they obviously are taking in those fumes as well. Or for example, if you're smoking and your child is around you, and maybe you're smoking in the balcony or something, thinking that it's safe, I'm smoking it out, those things, those fumes are getting accumulated in the balcony. And when your child crawls and touches on those walls and then maybe licks on them, that smoke is going inside and it can equally be harmful and cancerous as well. Then comes another important talk on the diabetes prevention. Diabetes is again quite common both in men and women. And what do we do? Obviously, first and foremost, get a regular blood sugar test done only when your physician asks you to, not by yourself. I know there are blood sugar machines available which allow you to test whenever you want to, but pricking yourself too much is unnecessary. Do not do that. It increases your anxiety as well. Increase your fruit and vegetable consumption. Everything boils down to diet, isn't it, guys? So make sure that you are eating healthy, because eating healthy leads almost you to the perfect positive balance in your life. There are a lot of people who come to me, and probably some questions at the end of the session as well, where you asked me, the doctor, there were these friends of mine who were eating extremely healthy, no smoking, no drinking, never even increased the speed limit in their car, and still they got cancer. Then what is the point? I know this is quite the Bhagavad Gita question, that what is the point of life or death, and what are these under our control or not. I'm going a little on the philosophical side, but it is important to understand that, see, I agree with, as I said, this is something that is out of our control, but that's the whole point. This is what I spoke about in the stress management part. Focus on the things that you can control. If you see, it's been found that in studies, that if you at least try to control this diet and exercise and not having the smoke, drink and stuff, there are higher probabilities of you not getting into any unnecessary cancers and problems. It is very simple to think that it's okay. If I'm living up to 50, it's fine. That's all I want in my life. But you need to think of your family as well. You leave behind people, you leave behind emotions, and if you're leaving behind such a heavy responsibility, you need to be responsible yourself. Otherwise, you can absolutely be carefree, and then you might say that fine, I might not get married or something. That's also something that people respond to me as. So then why what about your parents or someone who has taken care of you, helped you be the person who you are, or your friends who have been there with you for through the thick and thin in your life? So everything matters, and that is why I'm speaking of this, because yes, fruit and vegetables are very boring. It's the fun food that we like, all this KFC and Burger King things. And I'm not denying the fact that I don't eat them. I eat them very, very rarely as well, but I do. And see, things in moderation is always safe. When you go beyond, when you cross the limits, then it becomes bad. So know where you need to stop. Exercising again comes back at least 20 minutes a day. There can be different forms. For a lot of women come and tell me that we find it very uncomfortable and difficult to go to the gym and work out. So why not do something that you all were doing from your childhood, or something like skipping, or maybe going for a walk with your friends or something, maybe just climbing stairs ups and down. That's it. As simple as that, but your exercise is done. Maintain a healthy weight, manage your weight according to your height, and that is why you need to understand your BMI. What is BMI? Body mass index. It's your weight which is divided by the square of your height. So once you calculate your BMI, which again a lot of apps also are there to check whether what's your BMI, and according to your age is it appropriate or not, you can definitely bring that under control with a little bit of diet and exercise. And for those who are diabetic, probably even attending my session right now, remember, in diabetes, healing becomes very slow or negligible. So you need to make sure that you do not get any injuries. And if you get any injury, you take utmost care and do not do anything to worsen that injury. Yes, a little kind of moral education kind of a thing. Wear your seat belts even on short trips. You might think that it's okay, nobody's watching, but it's not about nobody watching. It's about you being safe. Do not exceed beyond the speed limit. Again, very philosophical. I know it's very difficult, but it's a healthy habit. You listen to it, you work it out, your children look at it, your family looks at it, everybody learns from it. And the maximum, and this is something that was told to me by a cab driver, when I was a little in a hurry to reach from one hospital to the other, and that guy told me that, doctor, you might okay speed up today, but how much of a difference is going to make? 10 minutes? That's it. So that 10 minutes is not worth your life at all. Obviously, do not drink first and foremost. And in case, rarely, if someone is doing something, do not drive. Obviously, no mobile while driving, and wear a helmet. Such healthy habits are something that we all know, but when we listen to it, only then it's something that clicks. Do not be afraid to ask for help. This is the most important thing, because all of us are always scared that if we ask for help, something or the other will keep on building up and stuff. And I know, I'm not denying the fact that there are some unfortunate hospitals, or some places where once you go, there are a lot of charges which come into your day to day, and you don't know whether you're going through the right thing or not. That's why second and third opinions are allowed. It's that it's not that any doctor gets offended by that. If you feel that the doctor you're going to is not giving adequate care, and you're not being treated well, or maybe you're getting overcharged for the same or something, you can either talk to that same doctor, you can go and visit some other doctor, take a second opinion, a completely neutral one, and then understand what it is all about, right? So that does not mean that you go into the avoidance. You don't put yourself in a shell and tell yourself that, okay, if I don't know anything, it'll be much more easier. No, with time it becomes worse. In the beginning, it's much more simpler. As simple as a malaria or dengue can be so harmful and so much worse, as mild as something as maybe a cold also turns out to be very dangerous. And sometimes even the biggest of the problems, like a tuberculosis, which when diagnosed early on, can get you better within a few months, and then you're out of it. So it all depends on how quickly you take care of things. Yes, and almost coming to the conclusion of our talk, but a very interesting and the most important one for men to understand, and for those women who can take care of their men again, is prostate cancer. What is this prostate? Prostate is this gland which is present below the bladder in men, and it surrounds the top portion of the tube that drains the urine from the bladder. So as you can see, if this is the bladder and this is the urethra, the tube through which the urine passes, the prostate is at the tip, at the end of the bladder and the start of the urethra. How common is it? 1 in 6 people have a chance of getting it. Isn't that huge? And if it is not prostate cancer, the very common next thing that can happen is benign prostatic hyperplasia, which means that your prostate enlarges in size and that stops the flow of urine, which is why you must have seen elderly men again and again go to the urine, and women are obviously very angry and tired of them doing this. Is it serious? Obviously, it is. This is one of the most dangerous cancers, and 1 in 33 people have a chance of dying from it. So, what are the symptoms? Quite often in the early stages, there are no signs and symptoms, and it eventually can start showing certain things in the advanced stages, which you can see, as I said, trouble in urination. Obviously, because the tube gets blocked and then urine does not pass that freely. There's pain or burning while you're urinating. There's a decreased force in the stream of urine. There can be sometimes blood in your urine, or for those who see their semen, they might see blood in them. Bone pain, because sometimes that can spread to the bones. You can start losing weight without trying. Cancer is something like that. Erectile dysfunction. Yes, suddenly you've lost your erection. And in this age group, somewhere around above 50, 55, 60, if you're seeing that you're having a loss of erection, then you can probably get yourself tested. And sometimes a constant pain in your lower back, pelvis, or upper thighs. What does screening mean? Screening is simple. It's only something that we look for the signs of the problems. It's not the entire test. It's just the basic introductory test. If it comes positive, then and only then we go for the final test. So screening for prostate cancer is looking for an early stage disease where the treatment can be more effective. And what are the screenings that we can do? We can do a digital rectal examination. I know it sounds scary, but it's not. It's very mild, very simple to do. The prostate can be felt from your rectum, so that is why a rectal examination is done. Then we can do a blood test called as the prostate specific antigen. And this DRE and PSA can tell you if you have the cancer or not. And if these come out to be negative, you do not need to do any further tests. Skin cancer is one more cancer which is quite common. Now, this is again common for both men and women. So for both, it's important. Primarily men. Why? Because in men, these are the cancers which come out to be more positive. So family history of any skin cancer, any moles, probably more than 50 in your body, or large moles are significant. Any skin that burns easily. And yes, most important is sun exposure, which is the single most preventable risk factor. Be a healthier you. Why? Let me summarize today. Leading a healthy life requires these few things: eating healthy, exercising regularly, having regular examinations and screenings, drink plenty of water. What is plenty of water? In the COVID period, people had spoken about water. Water flushes down the virus, flushes down most of the infections, brings a good growth of your skin, of your abdomen, everything. So approximately 2 to 3 liters are minimum every day, and 4 to 5 liters is quite healthy to drink. But a minimum of 2 to 3 liters is necessary. No alcohol, smoking, and yes, learn stress management. Stress management is not just a 5 minutes lecture that you can listen on YouTube. Sandeep Maheshwari, yes, he talks well, but it's not all about only that. A lot of people come and tell me that I listen to all Sandeep Maheshwari's talks and that's why I'm very healthy. That's not true. You need to learn it, you need to implement it, and you need to practice it on a daily basis. It's not just listening, but also working on it. Good health is not something that we can buy. However, it can be an extremely valuable savings account. So, guys, start taking care of your health, and not just your physical health, but your mental health as well. So that's me. That's my Instagram ID, where you can somewhere learn some new things about either psychology or sometimes even physical health as well. It's Psychiatrist Speaks, very much somewhere where I respond to anonymous messages as well, in case you want to ask something without revealing much about things. That's my mobile number and email ID as well. I see there are two questions and I will answer them now. Firstly, someone asks that I'm a 28-year-old and I have high triglyceride levels around 260. I have a sedentary work life, but I do cycling and walking and don't eat fried or excessive oily food items. And I follow a routine Indian diet. What could be the potential cause and any suggested remedy? So, yes, this is interesting because a lot of people come and tell me that I've never had a burger or a pizza in my life. I eat only homemade food. I don't eat in between, and still my cholesterol is raised. So over a period of time, your metabolism slows down, and that's why cholesterol can get accumulated in your body, which is why that regular checkups let you know that the cholesterol levels are raised, and then you need to consult either a physician or a cardiologist, and they can guide you further on what medicine you need to start for the cholesterol. Yes, again, another question that people ask me is that I don't want medications for controlling my cholesterol. Ideally, everyone wants that, but sometimes it's not possible. And if you try to just work out or manage with your diet, as you were speaking of, that will not always work out, because that is not enough to reduce the amount of accumulated cholesterol. Medicines are not harmful. They can obviously uh, take care of the cholesterol levels quite immediately and quite safely. The second question that was asked is again very interesting. How do we know we are stressed and how do we manage it? Very good. See, to understand whether you're stressed, you need to see, there are no checklists or questions that you can confirm with. It's not necessary that everyone who is stressed out will experience the same things. So when you're stressed out, two things that you need to look for. First and foremost, whether you're able to manage your relationships well or not. For example, your better half, maybe your boyfriend or your girlfriend or your husband, wife, whoever it is, start realizing that you're distancing yourself, you're not able to connect with them well. For those who are not into a relationship or something, maybe their parents, maybe their friends, they start noticing that you become extremely asocial. What about introverts? Even introverts connect with some people at least, and they have some communication with some people. And yes, sometimes some people do not have at all. So that is what is the comparing point. You need to compare yourself to a previous you who was very active. If from the childhood itself you have been a very silent kind of a person, an asocial kind of a person, then it's normal. Then that does not mean that you are stressed out. And the second point that I was speaking about was your occupation, something that is necessary for your daily life. And if you're not eating well and you're not taking care of your physical health, you're not going to be able to focus on your work naturally, and your work will start getting affected. Your boss will start calling you and telling you to probably buck it up and things like that. So now you understand how you are stressed out. Beyond that, if still you think that there are questions unanswered in the stressed part, you obviously need to consult a mental health professional who will tell you whether yes, is it stress or not. And how do you manage it? Again, it's not a single line answer. You can practice some things by yourself, such as yoga, meditation, exercising every day, healthy, journaling, maybe practicing some gratitude exercises. But ideally, if you want to manage your stress, visit a mental health professional. Yes. Next, Umesh asks, how much sleep is required? I yawn a lot even when I've slept for 8 hours. See, it's not the amount of sleep. I mean, not number of hours. I can sleep for maybe 10, 12 hours as well, and still I could be feeling tired. So that could be because your quality of sleep is not good enough. So sometimes there are multiple reasons for sleep getting disturbed, and that is what we call as insomnia. We need to evaluate it. Obviously, there can be primary insomnia, which means that there is no cause for the insomnia, It just is a disturbance in your probably sleep hygiene levels, which means maybe the place where you're sleeping, or maybe the timings that you've changed, the environment that you're sleeping in, maybe the habits that you've gotten into. Maybe you're drinking a lot of coffee, maybe you're smoking just before you sleep, or something like that. So your sleep hygiene needs to change. And secondary insomnia can be something related to maybe something you're going through. For example, if you're going through anxiety or maybe depression or some other conditions, then your sleep starts getting disturbed. So if you're yawning too much, probably your quality of sleep isn't enough and you need to get yourself tested. Sometimes over the age, there can be a condition called as obstructive sleep apnea as well. So when you're, gaining a lot of weight, what happens is the flap in your throat closes on itself in on the windpipe, and then when you're sleeping you suddenly, you're not able to breathe because of the extra flap, and then suddenly you wake up. So when you wake up, you don't get enough sleep in the night, so you're yawning throughout the day. So it's obviously a very huge topic which I've concised into a short answer. There are some certain chats as well. I lost my cancer. I lost my father due to this cancer. Yes, unfortunately. How do we prevent this disease? I think I've spoken about it. What if you drink more water? The only thing that can happen if you drink a lot of water, you'll have to go and visit the washroom again and again, but there is no harm to it. Is wine good for health? Absolutely not. Wine is very much unhealthy, as is any type of alcohol. Alcohol, initially, people used to think a small amount is healthy. And some people, even when they have cold or something, drink a little bit of brandy or something, telling that it's okay, it's nice for the throat or something, but it's not. Obviously, because see, why is people, you're saying that alcohol is unhealthy is because alcohol goes and puts some weight on the liver, which means that its metabolism is done by the liver, and liver is normally accustomed only to take care of the food that we're eating. So in case you start drinking alcohol, it sidelines food and starts metabolizing alcohol. So naturally all the toxins in your body are getting accumulated, which is why you start getting a tummy, you start getting tired very easily. It starts getting harmful for your sexual health as well. So everything gets affected. What can we do to ensure proper vitamin B12 and vitamin D? Um, Obviously, eat your healthy vegetables and your fruits and everything. Vitamin D requires your some sun exposure in the day, and otherwise, this is something that has relatively come now, where people think about these, get these tested and something, but this is not something to be very much scared about. But naturally, if you're eating a healthy diet, your vitamin B and D won't reduce. At what time of the day should I expose myself to the sun? It's said that between 12 and 3, even though yes, it's a very harsh sun at that time, it's the ideal time currently. Previously, people used to say that it's the early morning sun, but that's not true. Okay, Mani says, I have a knee pain and I've consulted two orthopedics, x-rays done, they gave me medicines. I've taken these medicines, but still no relief, still the pain persists. This can be somatic pain, Manish. Somatic pain is a condition in which the pain is not related to the muscle or the bone within, but rather the nerve that traverses through it. So nerve pain commonly does present as maybe like, something more, but if you get it tested from maybe a physician or your mental health professional, they'll be able to help you with it. So you don't need conventional painkillers, you rather need medicines for those nerves. How can we improve our attention span? By obviously taking care of your physical health and your mental health both. Physical health by exercising, eating healthy, and the things that I spoke about. How do you take care of your mental health? By the help of meditation, yoga, taking adequate breaks. An ideal break is supposed to be taken every 40 minutes. That's why ideally they say that every lecture should be only for 40 minutes, because beyond that people start losing their attention span, like all of you have already done. Fruits and vegetables are now treated with chemicals, and how to buy the purest? I don't have faith in the organic ones. Even I don't. I try to get the natural ones as well. And the best way you can take care of that is by washing it with soap. And if required, if there is a COVID wave again, then maybe sanitizer as well. There is a specific vegetable sanitizer that is available which can, take care of that. How to keep your eyes lubricated naturally in a constant computer use. So first and foremost, you can use those lenses which are available, the blue lens which allows you to keep your eyes safe. And beyond that, to keep them lubricated naturally, you just need to keep taking small breaks. You can use your handkerchief or some napkin, maybe dip it in a little bit of water and put it on your eyes every 40 minutes or every 1 hour. Allow your eyes some rest, and that will naturally. Our eyes have natural ways of getting lubricated, so you do not need anything externally, ideally speaking. Is there anything else, guys, that you all feel you all want to ask me? I'm drinking my bit of water. I hope everyone else is drinking as well. And Deepika, do you think that we can come to a conclusion now?
Yes, I think if there are no more questions, I think we have one more question in the chat.
How to make guys speak their issues? You obviously can't force someone to speak their issues. It's something that they need to come out by themselves. You can make them comfortable. You can allow them that speaking space. It's a misconception that they say that men don't speak and women only speak, but men also speak only if you're given the opportunity to. So just let them be comfortable. Let them know that you're available to listen to them, and let them speak to whoever they are comfortable with, and that itself is the best way of allowing them to express themselves. But very good question, Sapna. I hope the guy that you're speaking about speaks to you. If you all
There's
get if you all get any
there's
other
one
questions that you all want to ask, there's one more question.
yeah, there's one more question, which is, are whey proteins safe to use for long term?
No, it's not. See, whey proteins are additional proteins. If you're utilizing these proteins, then it's okay. That means that if you're working out and your gym instructor tells you, who is probably hopefully a certified nutritionalist, is telling you to use it because, see, if you're working out, your muscles are using up the protein in your body. So you need extra protein for that. In that regards, whey protein is healthy. You do not need to take any steroids or something. So before starting with any proteins or something, you can always ask your physician whether it is healthy or not. And otherwise, if you're not working out and you're just leading a sedentary lifestyle, then ideally do not use any whey proteins or anything like a supplement. Your healthy diet itself is much more than enough. Okay, one more question. I have a cyst on my head for more than 5 years and it does not pain until pressed. I want to operate it, but my spouse is afraid that it might take some nerves on my head, and she's pushing me for homeopathy medicines, but I don't have faith in those. That is quite a question that a lot of people do think of. See, I'm not saying that homeopathy does not work. Homeopathy is quite effective as well. But if this is something that requires an operation, then you need to take action. Otherwise, if it gets worse, then there will be other complications as well. Probably if it's I haven't reviewed your files and everything, so I can't comment exactly on it. But if you feel that homeopathy is working out and the swelling is reducing and things are getting better, so continue with it. Otherwise, consult another surgeon or something. Look at what is going, maybe the harmful thing, and then naturally you can take a call based on that. And tips to improve your calcium intake. Calcium naturally comes in your milk and in all these dairy products. So eat a lot of this cottage cheese. That is what paneer or something, which is something good for calcium again, and that's something that will improve your calcium levels in your body. Absolutely, Sapna. Yes, he is someone who is, trying to keep things within himself. You don't need to force him, rather, you need to tell it to him every day in a very soft and a comfortable manner to visit a doctor, and eventually he will understand your point of view. He'll understand that you're doing it only for him, and then he'll come with you to visit the doctor. Okay, so all of you, remember it's okay to be not okay. And I end this talk with a favorite painting of mine, which is a Van Gogh painting, which I believe most of you would remember seeing it from Sushant Singh Rajput's Instagram. But it's a very calm and positive painting which helps you feel relaxed when you look at it. So maybe you all can utilize it and keep it as your desktop wallpaper.
Thank you so much, Dr. Rahul, for taking the time and joining us today. And that was definitely a very insightful session that I think all of us learned something from, and that will help us all in our daily lives. And thank you so much to the audience as well for participating and joining us today and for asking all your doubts and being a part of the session. We hope this will help break some stigma around men's health and men's mental health as well. So thank you everyone for joining in. I think we can close the session here. Have a great week, everybody. Thank you.
Take care, everyone.